So you're watching Two GPs in a Pod. I'm at the Rethinking Remote 2018 conference in Inverness. I've been introduced to Jess Cooper, who's a GP, and she works out, where is it that you work?
I work on the Isle of Islay, which is one of the southern Hebrides on the
Perfect.
west coast.
So how have you got here today?
I flew from Islay to Glasgow yesterday evening and then drove up.
Excellent.
It took about 4 hours.
So we've got another general practitioner in Jess who has done this fellowship, and so I thought it would be a good opportunity. I know we've already spoken to Sarah, but it would be another good opportunity to talk to someone else who's had an experience of this fellowship, because it seems to me that this is one of the really interesting ways that people can get involved. If you are watching this and you've been kind of, you've been thinking, oh, I'm really interested in kind of becoming a rural practitioner, wherever it is, whether it's in Scotland, England or Wales, I know that this fellowship occurs in Scotland, and I'm not sure actually if it occurs in England and Wales, but certainly if you're interested in working in Scotland, then this is a good way in, because I'll let you explain. So how did you get involved in it?
So I got involved in the Rural Fellowship on the back of doing some work abroad, that then as I came back to the UK wasn't working back in an urban practice didn't seem quite as attractive maybe as I had done when I was doing my training, and I thought, okay, I've maybe got a slightly wider skill base now having worked abroad. I'd quite like to utilise that skill, and I'd quite like to build on it and not lose that skill when I come back to the UK. So I had to look into options for doing that, and the Rural Fellowship seemed like a really nice way to transition back into the UK, mainly because you get a mentor and a bit of training input, which was quite attractive, having had a few years where I haven't really had any training input at all.
Sure, yeah.
And the idea basically is that you are placed somewhere interesting in Scotland, you get support locally and also at a distance from the overall programme coordinator, and basically a third of your year you get to spend doing study stuff, all with the aim obviously of being a more effective rural practitioner and equipping you for those odd things that we end up having to deal with, the more acute stuff that we have to deal with. So all of the study time is focused towards that, but there's a decent budget and a decent amount of time that goes with that.
Great.
So that was all really attractive.
Where were you posted for your fellowship?
So I was on Islay.
Yeah, so okay,
which
fine.
I've ended up staying there. A salaried job paid, so I've ended up staying there.
Excellent.
So it's quite a small island. There's 3,500 people on the island and 5 GPs, and we do normal day-to-day general practice. We have a community hospital, which is some rehabilitation, some acute stuff, and we have an A&E.
And you're running those as well?
And we run all of that, yeah.
It's between the two, between all of you, so you do the
yeah.
different bits of what you need to do, and you rotate around.
And we rotate around, yeah.
Excellent,
so
okay.
Quite well as a team, it's good.
What's the most challenging thing, do you think, about working where you are in the way that you do?
I think probably the most challenging thing is that occasionally you do find yourself in the middle of the night with something that you don't really know what to deal with and are aware that it's difficult and that you are physically on your own, although there are lots of ways that we do kind of support each other within the team on Islay. We're all happy to be phoned in the night if there is a problem, and we have good links with the mainland in terms of people to support us in those acute
I found
skills.
that those kind of telelinks are really strong and really good.
Yeah.
What are the top 2 or 3 things that you love about working there?
So I think the main thing that I really love, and I think is a real privilege compared to what GP life looks like in other places at the moment, is that I go to work and I look at my list of patients and I know at least half of them, if not all of them, on a daily basis when I sit and go through my surgeries. And there is a real sense that I actually do, so I've been there about 2 years now, I have this feeling that I do actually know the community quite well and they know me. Yeah. And I feel like we have actually built real rapport and relationship with patients because there's quite a small number of patients. Yeah. And I think that's something that's really very special, because I think in general practice more widely, and certainly in urban settings, just the volume is so much that you just can't build those same relationships. And we know families really well, and we know the communities well, which is just great. It's
interesting you said that. I mean, one of the real strengths and draws and things that draw people to this is, that community aspect, but also you do get to focus on what you're trained to do.
Yeah, absolutely. So I get to be a real doctor in a way. I get to do the acute stuff in the middle of the night when people are sick. I get to do all the palliative care as well. We get a little bit more involved in antenatal care than we might otherwise. We try not to get too involved in obstetrics, but occasionally accidents happen.
Yeah.
So it's a real breadth, and it feels like you are using your skills and you're using your brain, and you're not just sitting following protocols and doing what you're told and spending hours looking at blood results.
So you kind of, it's not kind of that boundary of, okay, well, this is what we have to do and this is what secondary care have to do, you know. It's a lot more blurred, but that's full-on generalism.
It is, and it becomes more flexible then, so there are things that we'll say, we'll take that on, we can do that because that's a real priority for this particular patient to stay, and if the secondary care can give us some support to do that, we'll do that on Isla. So for instance, we do quite a lot of kind of procedures and infusions and all these sorts of.
And do you get funded for that then? Or?
Yeah, so we get some funding through the health board
Okay.
for that kind of like hospital practitioner stuff that we feel like, okay, that's actually a real priority for our community to be able to stay here and have that monthly blood transfusion or these other sorts of routine things.
Yeah.
So that's really
great.
well.
And we were and just the last point, we were talking about the differences perhaps. Obviously there are lots of differences between urban and rural practice, but we were talking about the example of having to wait for a retrieval, for example. So often, certainly for me, if I'm working in a standalone urgent care centre, my anxiety starts going when you've got someone really sick and the ambulance won't be there for 1 or 2 hours, and that gets my anxiety going. It's a completely different ball game here. So how long were you waiting for someone?
So the case that we were talking about earlier was a gentleman who'd fallen out of a window and fractured 4 cervical vertebrae, and we couldn't get him out for 12 hours because of the weather, so we were having to then think practically around, right, how do we keep him safe in that 12 hours? There's no literature about spinal boards for 12 hours and maintaining immobility and things, so there are kind of other things that we have to think around, which is good for us. I think it keeps your brains flexible.
One of the interesting things that's come out of this conference is this notion in the kind of introductory address of remoteness is not just location.
Mm-hmm.
And so whilst you are geographically remote, technology and your skill set really helps to bridge that gap.
Mm-hmm.
So there are other factors. For example, it does take 2 hours to maybe get to this place, but there might be other factors that complicate things. So like the weather, like you've exactly. So in terms of the risk sink that you have, it's often a lot deeper.
Yeah.
But some people love that, and some people it's not for them. But it sounds like it attracts a certain ilk of people who kind of really like getting stuck into that.
And I think that's a really nice community to be part of, so I kind of feel like coming along to conferences like this and having other meetings with rural practitioners, be that hospital practitioners or GPs, they're all really interesting people. They're really innovative. Innovative people that are just really interesting to hang out with, and I think part of that community. And
there's a sense here within that kind of this community of like-minded people of recognising and being proud, and certainly from my point of view, it come out here that maybe sometimes there's this feeling that metropolitan or urban practice is somehow better than rural general practice, and that certainly from my point of view, even before coming here, that certainly wasn't didn't even come in the radar of my thinking. There's a recognition, I think, in most urban people, urban GPs, that that's really interesting what they do, but I think having come out here, have a newfound respect, not that it wasn't there before, but it's certainly there's a respect for the full-on generalism that you guys do, so well done.
That's a really good job.
And do you have any messages for people who might be interested in getting involved in the fellowship?
I think the main thing, so having come through the fellowship, there was a group of us that went through at the same time, and there was a couple of people who had come from a background of maybe 5 years of salaried work in Nottingham, and were getting to that point where they were just feeling really drained, really not enjoying work at all, and they came and did the fellowship and actually just really rediscovered, we became doctors for a reason. We really like treating patients and feeling like we can do a good job, and in this environment a lot of us do have the feeling that we are more able to do a good job, and I think it is worth it. The fellowship gives a really nice 1-year opportunity to come and explore whether that might be for you in a really supportive way, and I think if you are getting to the end of your tether and feeling a bit hopeless about the joy that was in medicine, it can be found elsewhere, and the fellowship is potentially a really good way to explore that.
Perfect. Dr. Jess Cooper, Thank you very much for your time.
No problem.
Cheers.
at
All right.
Cheers.